friends from India. Today we are with the superstar of penile implants from Iraq, Dr. Anas. And all Indians who's watching this and who are worried about penile implants, I think penile implants is the excellent solution to cure erectile dysfunction. So Dr. Anas here, he does maybe 1,000 implants a year, and he's one of the highest volume implanters in the Arab GCC countries. And hi, Dr. Anas.
Hello, Dr. Gupta.
So how are you?
I'm very happy and happy to see you here in Doha.
Thank you so much.
I have seen you in Dubai. I have seen you in Istanbul.
Yes.
And now we are meeting now in Doha. And he is the superstar, not me, the superstar. He's the superstar. He's the highest volume implanter, as I know. And the thing is, in penile implant surgery, you don't look, pardon me, don't look for older surgeons. You have to look for younger surgeons like Dr. Gupta. Why? Because he's interested in updates. He's interested in improving his techniques. So this is the best surgeon that you're looking for. The one who does more than 200 cases per year, and the one who had that passion to do the surgery and to improve the surgery. So Dr. Gupta, within the last 5 years, he improved so much in implant surgery that everybody in the world is looking after him. He's a role model. He's a very good surgeon and a very good friend. Thank you, Dr. Gupta.
So as Dr. Anas said, so the penile implants, you need to go to a high volume center. Two reasons. One, the guy who's doing the most cases is updating himself, and most importantly, his complication rates are going down.
Yeah.
So when you do 1,000 cases, your complication rates are low. You go to a new guy, he puts a bad implant, he gives you a bad size, he gets you into an infection, and then, so I always say the first implant is the best implant.
Yeah.
If you do the first implant good, you are good for 10 years, 15 years.
Yeah.
And if you do the first implant bad, you keep on going through revisions again and again. Yeah. So what's your experience?
Yeah. So it have been proven that low volume implanters have more complication. The surgeon that do the surgery like less than 12 surgeries per year is more prone to have complications. But the surgeon that do like 100 case, 200 case per year is less complication. So the accepted complication rate is less than 3%. So me, you, we have that. Maybe we have less than 1%, but maybe in other centers of low volume, they may have complication as 10%. So that's why we started doing the surgery. It's like textbook surgery. You don't. Nobody can do the surgery. Okay, everybody is a surgeon. He can do a slit. He can put the implant in. But the trick is about the sizing, the expert in sizing. Dr. Gupta is expert in sizing. He knows where to go up, where to go down, where to cut, what to cut. And this is the most important thing about penile implant surgery.
And in your experience, every patient is different. So sometimes we see a surgery on YouTube, and we feel anybody can do it. But your anatomy can be unique. You may have curvature, you may have diabetes, you may have your corpora may be not very, very, very supple. And there's experts come into play because you can modify your technique.
Yeah.
Right?
That's this happens with years of expertise. So you take in in the Middle East we have maybe the husband can take 2 wives, 3 wives, 4 wives. So I take that in the matter. He's having sex more than the others. Maybe his age will definitely the size of the implant. Is he diabetic? Is he fibrotic? So sometimes you make the decision inside the OR.
Yes.
So that comes with the expert.
Yes.
And also one thing, the expert and the penile implant surgeon, the high volume implant surgeon, he's investing his money in his tools.
Yes.
So
very important.
Yeah. So he's putting a lot of money to get the right tools. I bring tools maybe from USA, from Germany, very expensive tools.
Yes.
You invest in those to improve your surgery and results. So I think that's what you do too.
So let's do a bit of myth busting. So in India, like in Iraq, a lot of patients are scared of implants, right? They feel it's a machine and doctor, give me something natural. So, in your experience, why should a man, go for an implant, right? Medicines are there, and there are a lot of other stuff that, magical stuff that they keep talking about. But in my experience, the guys with implants are happier because no more medication, and they feel complete.
A lot of patients, I have seen them before surgery and I have seen them post surgery, and they said, we regret that we haven't done the surgery maybe 3 years ago, 4 years ago, because they are very happy and very confident about the sexual intercourse. And it is the radical treatment. It's not just like the magical treatment of honey and herbals and pills. No, it's a true treatment. And a lot of men are afraid from pain. Pain will subside in like 3 weeks, 4 weeks. It will go away right away. And they are asking about, it is a foreign body inside my body. I will tell you something. Have you heard a lot of warriors that have shells in their body, and they live with it like for 20 years? That's exactly what happened, because the human body is designed to enclose all the foreign bodies with a sheath and protect it from the immune system. So this is also is happening with the penile implant. When you put the penile implant, after 45 days, it will be enclosed by a capsule, and it will be protected from the immune system. So it will be painless, it will be very effective, and you will gain confidence inside the room.
So there is a unique perspective that Dr. Anas can give us. A lot of old men who get implants in India are worried that will they be able to have sex with younger women. In Iraq, men take on second or third wives who are younger.
Yeah.
So do you think after a penile implant they can have sex with younger women?
Yeah, it's like the same point. If you are going to the right surgeon and you will put the right size, yes, definitely. We give them like a guarantee. You can penetrate a virgin wife. We say in the clinic, sir, after you doing the surgery, you are going to be able to penetrate a virgin wife. So it's a lot of
It's a lot of rigidity, right?
Yeah.
So a lot of patients who are concerned, that after implant I'll be soft. You can penetrate a virgin, so that means you're super stiff, super hard.
Super stiff, yes. This is with malleable and inflatable, but you have to choose the right size. This comes the professionality of the surgeon.
Yes.
If you choose the right size, you will give the maximum rigidity. Yeah.
Okay. You do both malleables and inflatables, right? So a lot of patients have this concern that inflatables tend to break down, and I will have to come for surgery again and again. What's your view on that?
So you said about mechanical failures?
Yes.
There are three companies, the Coloplast, the Rigicon, and Boston, and all of them give at least guarantee for 10 years if it was broken. And in my practice, maybe I've done like 1,000 cases. I have maybe 3 mechanical failures. It's less than 5 cases. So it's very rarely to get a mechanical failure for inflatable. It will stay maybe 10 years, maybe 12 years, and you will be happy with it.
Yes. So Iraq or India, implants are the same. They're manufactured by companies under very strict, manufacturing practices.
Yeah.
And what you're choosing for yourself is a A-grade quality product, right, which can change your life actually. And one more concern that patients have is that I'll become smaller. After implant, my size will become smaller. So what role does an expert play in that?
Actually, in malleable penile implant, I will consent them. Maybe they will lose 0.5 centimeter, but in inflatable, I will not say that. Either you get the same stretched penile measurements, or is more with inflatable.
Yes.
If you are using the new models of axial expansion. So in malleable, he may lose 0.5 centimeters, but in inflatables, definitely he will get his size or maybe a little bit more.
But only if done by experts, because it's the expert who decides the correct size.
Yeah.
So a newer guy will put you a half a centimeter shorter because he wants it to be easy.
Yeah.
But if you have the right tools and you have the right knowledge and you are able to size it properly, you'll go for a size bigger.
Yeah.
Right. And one more problem that's very common is premature, early discharge and premature ejaculation. So I feel my patients improve their timing after a penile implant.
Yeah.
Is the same for you?
Yes, it happened with me. I think it's something with the psychological aspect of the patient, because he will be more confident inside the room.
Yes.
With his wife, and he's confident to do the sexual act, and I think it helps and to improve the premature ejaculation. Not all the patient, we don't guarantee that it will treat the premature ejaculation, but maybe 20 to 30% of the patient will improve even their premature ejaculation. And we have to say to the patients, implant surgery has nothing to do with ejaculation. So if you already have ejaculation, this is mostly for diabetic patients. If you already have ejaculation, you will keep your ejaculation even after surgery. If you don't have an ejaculation, retrograde ejaculation, and ejaculation, you will not restore your ejaculatory function after doing the implant. So it's maybe a lot of patients are asking, am I going to get problems with ejaculation, with urination? No, after implant surgery, with the right size, you will not have any problem with urination or ejaculation.
So Dr. Anas is a young surgeon, and I have seen him across the world. I see him in Turkey, I see him in ISSM, I've seen you in AAU, and I think you travel to the US also frequently.
Yeah.
So that's a great thing about younger surgeons, they travel. And today we had an excellent presentation in which we learned newer steps and newer techniques. Experts discussed together. So how do you think that helps? Because this is helping the patient, right?
If you are thinking about work, it will never end.
Yes.
If you are just sitting in your clinic and work, it will never end. But the smart surgeon who gives time for education and improving and continuous medical education, like you traveled from India to Qatar, Doha. Why? Because he wants to hear from this expert, that expert. He get this lecture to improve your ideas about penile implant surgery. Maybe something new from Russia, maybe something new from Germany, and you have it, you modify it for your patient. So he's visiting, and I'm visiting the AAU to improve my technique, to benefit my patients.
Yes.
I want to know the updates.
This is an investment for my future patients.
Yeah.
Right? So difficult ones, who we can do better. So one more thing we are noticing in India, I'm noticing is that slowly the women are becoming aware and they bring their husbands. So the husbands feel bad. My wife say I'm not good. But I think it's because the woman wants the relationship to become better.
Yeah.
So is there the same experience for you?
Yeah, I think she's very understanding woman. If she sometimes she guides them for your clinic. Yes. She will say this is the link for his clinic. Please go there. Or sometimes she comes with him to the clinic, and that's a healthy thing because she loves him so much. She wants to improve the relationship. She wants to solve that actual thing between them. But actually, it's not that much common like in Europe.
Yes.
But maybe in 20% of the patient they come with their spouse.
Because as I always say, penile implants is about love. It's about you. It's not only about sex. It's about you loving your wife again, about satisfying her, about making a closer bond. So penile implants is very important for a couple to grow.
For a family, for a society, sex is very important. And I have read this article about the causes of divorce in some country, and they have seen like in more than 50% of the cases of divorces the first problem was sex.
Yes.
So sex is very important. It encourages to have feelings of the family, and if you get a happy family, you will have a happy society.
So if you're struggling with erectile dysfunction, you can always find an expert near you. In India, I'm doing the surgeries. In Iraq, we have Dr. Anas. Iraq and even other Gulf countries, because he travels so much and patients from all over come to him. So if you're looking for a implant surgery and curing erectile dysfunction, my suggestion to you is to go to the expert, because the best guy will give you the best result.
Yeah.
Thank you, Dr. Anas.
Thank you
so much.
Dr. Gupta. Thank you.
If you're looking to optimize your vitality and performance, visit our website at drvijayantgovinda.com. We offer a range of products curated by certified experts like myself.